Hello everyone, my name is Dr. Janmejaya Samal. I'm a faculty member at the School of Public Health, SRMIST, Chennai campus. Public health has been a buzzword these days after the COVID pandemic. Otherwise, also public health has been in the market for so many years, and students are pursuing public health careers, and they are pursuing public health education at different institutes across the country and abroad as well. Today we are here to discuss about public health education. What are the courses that we offer, especially at our School of Public Health SRMIST Chennai campus, and what are the career prospects, what are the specialties of the school. To discuss that, here we have Dr. Hari Singh, who is a medical doctor and having a post-graduation degree in community health administration, having worked across different national and international organizations, having held leadership positions across international organizations. He's transitioned into academia and he's holding the position of Dean at the School of Public Health. He's here today to discuss about all these questions that we have or the students normally have as far as public health education and the career option is concerned. So let's start talking to him. Welcome, sir. And as a lot of young students are interested in public health career, and this became more pronounced after the COVID pandemic. Otherwise, also people were interested in public health as a career option. So to understand what is public health, would you like to throw some light? What is public health?
Yeah. In a nutshell, public health is about preventing diseases and promoting health at community level, at population level. When we think of healthcare, we picture doctors in white aprons moving around in the hospitals, nurses with white caps, they're providing care to the critically ill patients, CT scan, MRI and so on, ambulances. That's really critical and important aspect of healthcare industry, but healthcare is much broader than that. One of the important aspects is how we can prevent certain diseases at population level. Take for example diabetes. 40-50 years ago, diabetes was not that common in India. We used to get cases mainly from the affluent societies, from elderly people. But now some studies have indicated that every fifth adult in India is having diabetes. So what is the reason for this change? And more important, what could be done to prevent this further? As you know, diabetes, the burden of diabetes is steadily increasing in our community, in our country. So what could be done? For that, we need to take research. Research is an important component of public health. How we reach to the root cause of the problems and how we devise the strategies to address those causes. As you know, ours is a large country with a huge population base. So research involves collection of data on a very large scale. So that involves large database which is virtually impossible to analyze manually. So for that we need assistance of statistical softwares. So public health involves understanding the health burden of health problems in a population, research, how we understand the root cause of the problem, how we analyze data, how we use sophisticated statistical softwares to understand this problem. And then based on the identified reasons, cause of the problems, we devise strategies. You know, not only the specific cause of a problem, there are many other factors which influence the occurrence of a disease. The socio-economic conditions, their culture, their lifestyles, their habits, all these have strong bearing on causation of diseases. Yes. So public health involves in understanding all these factors and then addressing them. So then based on our understanding, based on the research findings, we design some projects, how we can address health problems at the community level. So that designing requires again proposal writing, devising the strategy, identifying manpower, what manpower would be required to address these problems, what activities would be undertaken by them, what logistics support would be required by these people. Then monitoring and evaluation is a very strong component of health projects. How we ensure that whatever was planned is actually executed systematically and produces the desired results. So this is about public health. And then one important aspect of public health is health promotion. What do we mean by health promotion? How we empower the communities to take care of their own health. For example, now lifestyle diseases, non-communicable diseases, we mentioned about diabetes, heart diseases, cancers. These are their burden is continuously increasing in our country, and causes we know that inactivity, dietary habits, these are some of the strong factors that determinants that lead to these problems, and it's not easy to change people's behavior. So public health, particularly its specialized area, health communication, that determines how we influence the behavior of people, how we promote healthy behavior lifestyles. So this is in a nutshell about public health.
Thank you so much, sir. What I understood from your narration about public health is that public health is all about looking at the problems of the people and understanding what causes those problems and figuring out strategies to address those problems. So it begins with identifying a problem and bring about changes, bring about strategies, bring about programs that can address those kind of problems. Now, since we both belong to the School of Public Health, SRMIST Chennai campus, and we work there, I would urge you to say a few words about the School of Public Health, its genesis, the intellectual capital of the school, and what kind of strengths that we have in the school, and what are the facilities that the student would get if they are wishing to study here in the School of Public Health, SRMIST.
School of Public Health at SRMIST was established way back in 2007. So we are one of the forerunners in public health academia, and strong multidisciplinary faculty is our strength. See, we have faculty who have worked with the international NGOs, with national NGOs, with research organizations, with government organizations, and after working in the field for number of years or decades, they have come here to teach public health. So that's something unique about our School of Public Health at SRM Institute of Science and Technology. We have expertise from epidemiology, biostatistics, health systems and policies, health communication, health economics, health data science, behavioral and social health. So these are some of the areas which are strong at School of Public Health. Research is a very, very strong component in School of Public Health. Data analytics, use of advanced statistical softwares, whether R programming or Stata or SAS, these are strengths of School of Public Health. Then we undertake a number of research projects at the school. NFHS, you might be aware that National Family Health Survey, this is possibly the largest cross-sectional study in the entire world, which is undertaken by the government of India. And we at School of Public Health execute this project in Tamil Nadu and Pondicherry. Similarly, there are a number of research projects which are funded by ICMR or Government of India or USAID, Wellcome Trust and so on. And our students get the opportunity to participate, to get involved in some of these projects. So that gives them real great opportunity to have hands-on training of project management as well as they get exposure to the field. Then we get students from many African countries, many neighboring countries of Nepal, Bangladesh, Bhutan, and so on, and they come from various backgrounds: medicine, from dentistry, from nursing, from life sciences, even engineering graduates, even biotechnology graduates. They are opting for public health. So it's a very diverse group which makes a very vibrant cohort and creates a great learning opportunities.
Thank you so much, sir. I mean, as I understood, we have specialized faculties in various areas, the disciplines that we spoke about, be it quantitative science, be it about social and behavioral science, be it medicine, be it economics, be it data science. I think these are some of the areas where our school has forte as far as our faculties are concerned. And as you mentioned, we have large-scale projects like and apart from National Family Health Survey, we have also projects from Indian Council of Medical Research, Indian Council of Social Sciences and Research, where our students get a lot of hands-on experience, working with this kind of project and supporting their faculty members as a part of those projects. So that gives a lot of scope for our student to understand. So having said that, since we have all these specialized facilities in our school, let's understand what are the courses that we offer at the School of Public Health. Sir, could you speak about the kind of or the different type of courses that we offer at the school? What are the eligibility criteria? What is the admission process? What is the timeline for the admission? And what kind of entrance examination that we conduct, or what are the contents? So maybe you can throw some light on those areas.
Yeah, we have 4 major programs besides our doctorate program. One is Master of Public Health MPH program, and this is open to graduates from all streams. It's not essential to have background of biology or science. Even students from commerce can opt for it. And these are the candidates. We expect them to have some interest in managing the health problems of the populations. They should be able to design and implement and monitor and evaluate health projects. They should have some idea about the research, how to understand the cause of the problems. And second program is on MSc Biostatistics and Epidemiology. And this is designed for candidates who have strong background in mathematics, at least at high school level. So they should love data. They should enjoy working on data, on computers, on statistical softwares. They should be really interested in doing research, in going to the field, in collecting data, in analyzing data, interpreting it, and preparing the reports. Third program is MSc Health Data Science. This is for those who have some background of programming, who are fascinated by the technology, the use of artificial intelligence, machine learning, algorithm, big data analytics, who enjoy doing this type of work on big data analysis and use of these things to improve health care of the populations. And then besides this, we offer an integrated program which involves BSc and Master of Public Health 5 years program. This is open for 10 plus 2 high school students. After completion of plus 2, they can opt for this program. And the options are same as in Master of Public Health. They learn to design health projects, they learn to conduct research, they learn monitoring, evaluation, and so on. Then doctorate program is there. It's for those who have completed Master of Public Health program and are interested in getting into academia of public health. So we offer doctorate program.
Thank you so much, sir. Now, the most important question that comes to a student mind is the placement opportunities or the career options that one could think of after pursuing a postgraduate program at the School of Public Health. Having three different kind of programs, like having a master's program in public health, having a master's program in health data science, and master's in epidemiology and biostatistics. Although they are related programs, but the opportunities for these kind of graduates would be different. So I would urge you to throw some light on the career options for a master in public health student, and for the MSc epidemiology and biostatistics and MSc health data science student, so that student who are actually aspiring to come down to School of Public Health to get benefited out of it.
The public health is peculiar in the sense it has diverse employment opportunities. One of the most lucrative areas to work is to work with international NGOs. There are large number of international NGOs working in India and as well as in other developing or low-income countries. Japaigo, PSI, JSI, Pathfinders. These are some of the international NGOs. They provide, they offer good salary. Their working conditions are good, and the candidate gets the opportunity to work with international colleagues, and also get the opportunities to work in other countries. Then there are national NGOs. National NGOs are like Tuberculosis Association of India, Population Foundation of India, Sathi, KHPT. So these are they also work at grassroots level. So the candidates get the opportunity to have hands-on training, hands-on experience at grassroots level, working closely with the communities. And based on that experience, they can really jump on to not only international NGOs, but to UN agencies like WHO, UNICEF, this type of organizations they can think of working with. Then students who are interested in research, there are a large number of research organizations. They are again both national and international level. National level, we have ICMR, we have PHFI, Sambodhi. At international level, 3IE, George Institute of Global Health, Population Council. These are some of the international organizations that work exclusively on research. So students can think of working with such organizations. Then there are an upcoming area is corporate social responsibility, CSR. Large number of corporates like Tata Trust, like Nike Foundation. So they have their health domain. They work in various areas, health or education or livelihood. So health is generally a very strong portfolio in many of these corporate foundations. So students can think of working with these organizations, and they are working across the country and mostly in industrial townships. Then number of consulting firms are there. They might you might have heard about Ernst & Young, PwC,
EY,
Grant Thornton,
yes.
Grant Thornton, then Policy Management, Oxford Policy Management Group. So these are some of the organizations. They provide consultancy on health domain to various state governments, and they require people with strong expertise in public health or research. Then students with specific interest can find opportunities in health insurance, in IT companies. Number of IT companies work on health domain. They work on clinical research. They work on hospital management information system. So they also require people with background, this public health background. Besides this, in government, there are large number of opportunities with National Health Mission. at the district level, at state level, there are program managers, there are consultants, quality improvement consultants, hospital management consultants, public health consultants, epidemiology consultants. So students can think of working with these organizations, and then based on their interests, some of the students can think of getting into academia and pursue their doctorate and get into academia.
Thank you so much, sir. What I understood from the narration that, as far as career options for public health and allied health science graduates are concerned, I think there are two diverse disciplines. One is obviously related to research, and the other one is related to project management or program management. So, public health being a cross-cutting area, students can juggle between research as well as project management. And if they're interested in managing projects, working in a team, going to different field settings and all, I think that is one of the area they can think of. And research, which is a very specific area, if students are interested in analyzing data, in collecting the data, writing reports and writing research articles, I think that's one of the area that they can think of. And there are other allied areas like consulting, I think is one area where students can also think of. As far as health data science students are concerned, they can think of IT, insurance. Those are the specific areas. Clinical research organizations, especially the R&D divisions and the divisions that work with clinical data. I think that's an area where students from health data science as well as from AP Bio can think of getting into. So thank you so much, sir, for this enlightening narration of what is public health and a brief description about the School of Public Health, SRMIST Chennai campus, the intellectual capital of the school, and the strengths that we have at the School of Public Health, and the courses that we offer, the admission process, the eligibility criteria, and the entrance process and the timeline, as well as the career options for these three different kind of students. So thank you so much, sir.
Thank you.